So, hi ma'am, good day. My name is Eirene GAPATE from NR11 Group 2, and today I am going to demonstrate the procedures in complete bed bath. So, the purpose of complete bed bath is to stimulate circulation to the skin, promote a sense of well-being, produce relaxation and comfort to the patient, prevent and eliminate unpleasant body odors, and of course, remove transient microorganisms, body secretions, excretions, and dead skin cells from the patient. Now, for the assessment, check the chart for information related to the patient's ability to participate in the procedure. Next, assess the patient for specific symptoms that may affect the procedure, and check to see what supplies or equipments are already in the room. Now, for the planning, determine the assistance needed to make it easier for me and to the patient to do the procedure. Then, obtain the needed supplies such as basin, soap, hamper, clean linen, bath blanket, bath towels, clean garment, toilet articles, and gloves. So, earlier, I have already washed my hands. So, now I will just be donning clean gloves. I am now ready to enter the patient's room. For the implementation, identify the patient and explain the procedure to facilitate the patient's participation and cooperation with the procedure and reduce anxiety. Now, adjust the bed to a comfortable working height. Then, provide privacy to the patient to protect his dignity. Now, offer to the patient his urinal as he will be more comfortable after voiding. Then, remove gloves and perform hand hygiene. Put on your gloves. Then lower side rail nearer to you and assist the patient to side of the bed where you will work. Have the patient lie on his or her back. Now, loosen top covers and remove all except the top sheet. If linen is to be reused, fold it over a chair. Place a bath blanket over the patient and then remove top sheet while patient holds bath blanket in place. Place soiled linen in laundry bag. Remove the patient's gown and keep bath blanket in place. If the patient has an IV line and is not wearing a gown with snap sleeves, remove gown from other arm first. Then raise side rails. Now, raise side rails. Now, fill the basin with a sufficient amount of comfortably warm water. Change as necessary throughout the bath. Then, lower side rail closer to you when you return to the bedside to begin the bath. Now, put on gloves if necessary. Fold the washcloth like a mitt on your hand so that there are no loose ends because a bath mitt retains water and heat better than a cloth loosely held and prevents ends of washcloth from dragging across the skin. Now, lay a towel across patient's chest and on top of bath blanket. With no cleanser on the washcloth, wipe one eye from the inner part of the eye near the nose to the outer part. Rinse or turn the cloth before washing the other eye. Using separate corners prevents transmitting microorganisms from one eye to the other, while wiping from the inner to the outer canthus prevents secretion from entering the nasolacrimal ducts. Bath the patient's face, neck, and ears. Then, expose patient's forearm and place towel lengthwise under it to protect the bed from becoming wet. Using a firm strokes, wash the hand, arm, and axilla, lifting the arm as necessary to access axilla region. Rinse if necessary and dry. Firm strokes from distal to proximal promote circulation by increasing venous blood return. Now, place a folded towel on the bed next to the patient's far hand and put basin on it. Soak the patient's hand in basin. Wash, rinse if necessary, paying particular attention to the spaces between the fingers. Then dry the hands. Repeat the procedure for the other arms nearer you. Soaking of the hands, loosen dirt under the nails. Next, spread the towel across patient's chest. Then, lower the blanket to the patient's umbilical area. Wash, rinse if necessary, and dry the chest. Pay special attention to the folds of skin under the breast if the patient is female. Lower the bath blanket to the perineal area. Place a towel over the patient's chest. Covering the perineum promotes privacy and maintains the client's dignity. Wash, rinse if necessary, and dry the abdomen. Carefully inspect and clean umbilical area and any abdominal folds or creases. Return the bath blanket to original position and expose far leg. Place a towel under the far leg to protect the bed from becoming wet. Again, using a firm strokes. Wash, rinse if necessary, and dry the legs from ankle to knee and knee to groin. Wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between toes. Repeat for other leg and foot. Make sure patient is covered with bath blanket. Change water and washcloth at this point or earlier if necessary. Bath water and washcloth may become dirty or cold because surface skin cells are removed with washing. Assist the patient to prone or side-lying position. Then, put on gloves if not applied earlier. Position the bath blanket and the towel to expose only the back and the buttocks of the patient. Again, wash, rinse if necessary, and dry the back and the buttocks area. Pay particular attention to cleansing between gluteal folds and observe for any redness or skin breakdown in the sacral area. If not contraindicated, give the patient a back rub. Back massage may be given also after a perineal care. Now, raise the side rail to ensure the safety of the client. Then, refill basin with the clean water. Discard washcloth and towel. Clean the perineal area or set patient up so that he or she can complete perineal self-care. If the patient is unable, lower the side rail and complete perineal care. After that, raise the side rails, remove gloves, and perform hand hygiene. Help the patient to put on clean gown and assist with the use of other personal toiletries such as deodorant or cosmetics. Now, protect the pillow with towel and groom the patient's hair. When finished, make sure the patient is comfortable with the side rails up and the bed in the lowest position. Dispose soiled linens according to agency policy and perform hand hygiene. Now, for the evaluation, evaluate using the following criteria such as fatigue, feelings about comfort and cleanliness, and objective signs of cleanliness. Then after that, document as appropriate according to the facility.